Hello everybody, and welcome to the Tuesday edition of Video Clips. And as usual, I'm going to start with a couple of announcements. And the first one is, don't forget about our amazing brand ambassador program, where you join Wellness Farm Health and complete some basic training so that you can go out and help inform the rest of the world about informed medical decision making, help people learn about this and how it can benefit them. And if you're interested in that, there's all kinds of special benefits. In fact, we have posted a new video on the front page of our website, what's new with Wellness Farm Health, that you can go check it out. So go to wellnessfarmhealth.com, you'll see the new video right there, and you can listen to some details. And of course, as always, you can email me for details. You'll also see in that video some information about the next mentoring course, Professional Mentoring and Development course, which begins February 20th. This is an opportunity for those of you who are starting a business or taking your business in another direction, some health-related field. And this is everything from personal trainers and chefs to nutritionists to doctors to anybody who's doing anything health related, an opportunity for you to learn how to develop your business in productive ways, and everything from writing curriculum, making presentations, to how to deal with people and help them overcome their barriers. And then if you're a member of Wellness Farm Health, we have a new free course for you to take on the members site. It's called Informed Health 201. It is an extension of our 101 course. It just goes into a lot more detail about the medical decision making, reading your blood tests so that you know what you're talking about, you know what questions to ask your doctor, when you should be concerned, when you don't have to be concerned. Some information on how to read medical research so that you can have an understanding of what you're looking at. Lots of wonderful information in this course. So those are the new things going on. One last thing I'll mention is our fabulous business partner and I think the most important psychiatrist in the world. His name is Dr. Peter Breggin. We just today got the first course that Dr. Breggin and I designed called Why and How to Withdraw from Psychiatric Drugs, approved by the state. We'll be offering it later in this winter semester toward the spring. We'll begin the actual first course. So if you're interested in learning more about that, if you're anybody who interacts with somebody who has psychological issues, whether you're the parent of a child who's been placed on these drugs, or you have family members, or you're a medical doctor, or a counselor, judge, attorney, prosecutor. And there are lots of people who need to know more about this. So if you're interested in this topic, send me an email and we'll add you to the list of people who are interested in knowing more about this course when we're ready to offer it. All right, let's get to today's topic. And it is treating low back pain. Kind of some surprising information in this article that I'm going to talk to you about. Chronic low back pain is the leading cause of disability all over the world, not just in the United States. It's one of the most common reasons why people miss work, and it's the second most common reason for doctor visits. Over half of all Americans claim to have some form of back pain sometime during every single calendar year, and billions of dollars are spent for treatment. Back pain is expensive and disruptive, and one of the reasons why that's so is because everything we do about it is completely ineffective. The problem starts with how we diagnose it. MRI and X-ray are commonly used to try to identify the cause of the pain, but both are so unreliable that the American College of Physicians and the American Pain Society recommend against any imaging unless persistent neurological symptoms develop. Other than that, they say don't bother. And of course, I'm not talking about when somebody breaks a bone or something like that. I'm talking about the normal aches and pains that people get, particularly in the low back area. Now, the treatments aren't any better. A randomized placebo-controlled trial that evaluated the efficacy of acetaminophen, so we're talking about drugs like Tylenol and Excedrin, for low back pain, showed that the drugs were useless. They didn't relieve pain, they didn't improve the speed of healing, or positively impact anything, including disability function, global symptoms change, sleep quality, or quality of life. The patients who took the drugs were no better off than patients who took a placebo. Lead author Christopher Williams said, quote, "The results suggest we need to reconsider the universal recommendation to provide acetaminophen as a first-line treatment for low back pain." The researchers concluded that, quote, "advice and reassurance rather than analgesics should be the focus of first-line care." Now, Nsaids, or non-steroidal anti-inflammatories, not much better. In fact, they reduce pain an average of 1 point on a 10-point scale. Even opioids are useless for relieving pain, improving quality of life, or restoring function. And of course, I think most people know that they're highly addictive, which means that physicians should, and I have to say more of them are, thankfully, being extraordinarily conservative about prescribing them. Surgery has also been determined to be useless in most cases. A Cochrane review concluded that there are no randomized controlled trials showing that spinal fusion relieves chronic pain. Another Cochrane review of 31 randomized controlled trials concluded that evidence did not support the use of spinal fusion for back pain or spinal decompression. Now, according to a new study, and this is where things get really, really interesting, the best thing to do, nothing at all. All right, so here's what I mean with this. Patients with persistent low back pain were randomized to receive treatment as usual, called TAU, or to take a placebo. At 3 months, the patients taking the placebo were significantly better off in terms of pain reduction than the patients assigned to the TAU group. When the TAU patients were subsequently given the placebo, they experienced significant reductions in both pain and disability. So doing nothing's actually better. Now, it gets better than this. Let me explain how these researchers did this study. The patients taking placebo pills knew that they were, and in order to prepare the placebo-taking patients for success, researchers showed them a short video that reported the findings of research studies showing the benefits of placebo treatment. They were told that the body can respond to placebo and compared the response to the response of Pavlov's dogs. They were told that having a positive attitude would go a long way in helping them to succeed, and that it was important to take the placebo pills exactly as directed for 21 days in order to increase the chance of pain reduction. Education about the benefits of placebo treatment worked. The patients experienced better outcomes than the patients who received the quote-unquote real treatment. Now, there are several important conclusions to be drawn from these studies. First, commonly used treatments for low back pain, drugs and surgery, have little efficacy. Second, back pain is usually not related to a structural abnormality, which is why the images are unreliable for identifying the source of the pain and why the placebo pills work so well. Third, the attitude of the healthcare provider obviously has a major role. In this study, the researchers were able to convince people who knew they were taking a placebo that they would get better if they put forth the right effort. I mean, talk about just amazing. I mean, maybe we could do that with a whole lot of other things too. Now, Dr. John Sarno, the author of Healing Back Pain, made a similar discovery many years ago when he found it incredulous that people continued to experience back pain years after they had experienced a strain or sprain of some sort. Sarno decided that the cause of pain in many cases was emotional and not physical, so he started teaching classes to patients who had persistent pain, during which he explained that there was absolutely nothing wrong with them and that they should go home and resume normal activities and start exercising. Now, what's interesting, I covered Sarno's book in an advanced study course, and there are 2 lectures based on the book posted on the advanced study platform. But in addition to reading his book, which I found fascinating, over the years I've actually had the opportunity to meet, I would say about a dozen of Sarno's patients, and here's what they say. They were very grateful for Sarno's treatment, if you want to call it that, which he refers to by his knowledge therapy, and I think that's a good, I say that's what we do here. It's knowledge therapy, teach you what you need to know in order to heal yourself. And some say that some of these patients have said that they were heading for a lifetime of disability as they focused on their pain, they increasingly limited their activities and learned to live life around their problems, but after a few hours of Sarno's knowledge therapy, they were completely cured. Of course, this doesn't mean that images are never warranted or that drugs and surgery are never a good idea. It's just that these strategies should be the exception rather than the rule. Telling people to go home and live normally may be the best medicine of all. Well, that's all for today. As usual, please pass this on to anybody who you think might enjoy watching it, and I will be back to you on Thursday with more news.